Hello and welcome to Bible Way Church of Atlas Road. We're so honored that you chose to worship with us. If you haven't already, please be sure to like us on Facebook and follow us on Instagram and Twitter. You can also subscribe to our YouTube channel. And don't forget to share with your family and friends.
You can watch our worship services live through our website at BWCAR.org or through our Facebook page at 8 a.m. and 11 a.m. on Sundays and 7 p.m. on Tuesdays. For previously recorded sermons, you can tune in on Sundays by way of radio. That's 10 a.m. on WWDM 101.3 FM and 7 p.m. on WFMB, now located on 96.1 FM. Don't forget, you can also check us out on YouTube at Bible Way Church of Atlas Road. Remember to subscribe and turn on your notifications.
Join us Tuesday, May 26th at 7 p.m. for our online Town Hall Church meeting. We'll be discussing the resumption of our worship services here at Bible Way Church of Atlas Road. The meeting will be led by Pastors Darrell Jackson and Willie Jackson, Dr. Cedrek McFadden, a board-certified surgeon, and hosted by me, Artemus.
You can submit questions by Sunday, May 24th to info@bwcar.org or during our live service via our Facebook page. The meeting will also air on our website at bwcar.org and live on the radio through 105.1 FM on the Worship and Word Network. Join us for a virtual communion Sunday, June 7th during our 8 a.m. and 11 a.m. services. Just provide your own sacraments of bread or crackers and juice. We would like to congratulate all of our 2020 graduates. Sunday, June 14th, Bible Way Church of Atlas Road plans to host an online graduation service for its high school graduates. If you would like to be a part of this virtual experience, send your full name of your high school, along with your email address to wired@bwcar.org. Parents, we want you to know that your little ones can virtually attend our live Sunday school lessons. You can receive them via email. Just go through our website at bwcar.org and complete the Stay Connected With Us form. Bible Way Church of Atlas Road will be distributing food to those in need Tuesdays from 10 a.m. to 2 p.m. Deliveries will be free for seniors ages 65 years or older within a 10-mile radius of the church. Deliveries will be available on Mondays, Wednesdays, and Fridays. Call 1-888-776-1238 to schedule a pickup or delivery. We want to encourage all men to join our men's prayer line. Call in Saturdays at 7 a.m. for morning prayer and Thursdays at 7 p.m. for men's study. The number is 1508-924-1141. No access code is needed. In these times, prayer is needed more than ever. Redeeming the Time prayer line will be open each Tuesday morning at 5 a.m. The number is 1425-436-6302. Enter the access code 782443. Join us online Sunday at 8 a.m. and again at 11 a.m. as Pastor Jackson delivers a special message for our Pentecost service. If you find yourself in need of assistance finding food, paying housing bills, or other essential services, call United Way by dialing 211 and entering your zip code for a listed agency. For accurate and up-to-date information regarding the coronavirus, contact DEHEC and the CDC.
We can all help stop the spread of germs and prevent the spread of respiratory viruses like COVID-19 and the flu. Wash your hands for at least 20 seconds. Avoid touching your face with unwashed hands. Avoid skin-to-skin contact with other people. Stay home and away from others while you're sick. Cover your mouth and nose when coughing or sneezing. And finally, clean frequently touched objects and surfaces. For more information, visit scdhec.gov/COVID-19.
We want to thank you for your continued financial support to the ministry of Bible Way Church of Atlas Road. We want to be sure that those that are able to give know how to do so, so we set up a step-by-step tutorial. Here are the following ways you can give. Online through My Connections via our website, bwcar.org. So you'll type that into your browser. Scroll down, click on the Give Online icon, type in the amount that you would like to give. Then click to the right of your giving amount to select where you would like to give. Enter your email address for your receipt and click Continue. You can continue to give as a guest, or you can log in and create an account. Once you've decided, fill out your payment details and click Give when you're done. You can text BWCAR along with your giving amount to 73256. Wait for a response and click the link. Once you've clicked the link, fill out your payment information, then click the icon Give along with your giving amount. You can also send a recurring payment through automatic draft with your bank or My Connections. To access My Connections, type bwcar.org into your web browser. Click on the top tab or scroll down to the very bottom of the page and click on My Connections. You can sign in or continue as a guest. If you would like to create an account, it's easy. Click on the icon that says Get Started with My Connections. Look for Need a Login. Select the link that says Click Here. Type in your email address, your first name and your last name. You may have to confirm your username in your email. Once you've signed in, you can select Manage Schedule Giving under the My Giving summary and follow the instructions to schedule your recurring payment. You can also send a check via mail to Bible Way Church of Atlas Road, Accounts Receivable, P.O. Box 90309, Columbia, South Carolina. That zip code is 29290. Please do not mail cash. We'd like to thank our internet audience, especially our first-time viewers, for tuning in. If you desire prayer, please call 1-888-776-1238. If you feel as if this service was a blessing to you, please be sure to share it to your page. For additional announcements and for more information, please be sure to visit our website at bwcar.org. Hello, everyone, and welcome to our virtual Town Hall Church meeting. I'd like to take the next couple of minutes to introduce our panelists for this evening. From left to right, we have our pastor, Willie Mae Jackson. We have Pastor Darrell Jackson. We have Dr. Linda Bell, who is South Carolina State epidemiologist. She is a medical doctor for the Bureau of Communicable Disease Prevention and Control for DEHEC. Finally, we have Dr. Cedrek McFadden. Dr. McFadden is a member of Bible Way's Board of Trustees and a board-certified surgeon. Thank you all for your time. At this time, we're going to be turning things over to our pastor. Darrell Jackson will have a few remarks to explain the purpose of tonight's meeting.
Thank you, Sierra, and to all of those that are joining us, thank you so much to our wonderful guests, Dr. Bell, Dr. McFadden, our Associate Pastor and First Lady Jackson. We wanted to have this opportunity to share with you in our virtual audience so that you will have an opportunity to answer any question, to have your questions answered, to share with us any concerns you have, and for us, more importantly, to share wonderful information with you. Let me begin by thanking you all for supporting this ministry. Over the last 10 weeks, we have had services virtually, and we want to say a very special thank you to all of those all over the world, in fact, for being a part of these services. May God bless you. May God continue to get the glory out of all the things that have been done. And as we always say, we're so grateful for the other ministries that are doing what we're doing also. I think if there's one good thing that has come out of this, it is that we are universal, and the gospel is now being shared by so many people all across the world. So thank you. May God bless. Back into the hands of CR.
Thank you, Pastor. First, we'll be taking a few questions that were previously submitted online, and then we'll be taking a couple of the live questions that we have from our Facebook page and from our website. The website is BWCAR.org. So the first question will be for Dr. Bell. That's going to be, how do we determine the capacity for returning to service?
Yes, thank you, Ms. Sierra. Thank you, Pastor Jackson. The decision about how to return to services safely has to do with measures to minimize contact with people who are potentially infected with COVID-19. And that is accomplished through social distancing primarily. And so there are guidance documents available that provide information about the recommended capacity for facilities. And according to the governor's orders, buildings should only be held in a capacity of 25% of what the fire marshal recommends for the maximum capacity. So that's one indication. But there can be circumstances where you can comply with that 25% of the fire code, but additional measures should also be taken to make sure that people stay about 6 feet away from each other, so paying attention to how the pews are filled. And the 6 feet of social distancing is in addition to the recommendation for wearing masks. So the decisions about returning to services safely to reduce harm, to reduce the potential for exposure, has to do with those factors. It's to maintain the social distancing. So that could mean from side to side in a pew, but also paying attention to people who are in front of and behind you. Just a reminder that this is a respiratory illness that's spread not only by coughing or sneezing, but also by breathing, potentially, if someone is infected, and individuals can be spreading the infection prior to having any symptoms. So although we recommend that people not attend services or public gatherings if they're ill, if they're aware of symptoms, we also recommend that they do wear a mask at all times because of the possibility that they could be spreading before symptoms occur.
We've had several people ask questions about the wearing of masks since you've mentioned it. When should masks be worn? And you've already answered the proper social distancing in church. But someone asked, should we take the temperature of everyone that are entering the building?
It's not recommended to screen people with a thermometer to take everyone's temperature attending a church service. So we do want congregations to be aware that, and that should be communicated, that people should not show up for services, not only if they're sick, but also if they've been in contact with someone who is sick. Again, because of the potential to have the virus spread to someone, and they could be incubating before they recognize that they have symptoms. So to attempt to screen everyone at the beginning of a service to check for temperatures or to monitor for symptoms is really not recommended. That relies on personal responsibility and making sure that the message is communicated to stay home if you're sick. And we'll just add a note about the masks, that the masks are recommended not just for people who are potentially ill, But for people who could have serious complications should they become infected, for people who may have contact with loved ones or family members or others who could have potential complications. So the list is long, and that's the reason that we really recommend masks for everyone when they're going to be in a public gathering if they can't maintain social distancing. And there are times when you can remove a mask when you're talking or something like that. But trying to maintain the use of a mask if you're going to be in a confined area for a prolonged period of time, longer than 10 minutes, that's the purpose of the mask, to reduce potential exposure.
With that being said, what are the recommendations for children for masks?
So for masks, very young children should not wear masks. And this is information that is available on our website because I don't actually remember the cutoff age, but relatively young children, I would say kindergarten and above, can safely wear a mask. One of the worries is that if the mask is uncomfortable and they're just repeatedly touching their faces and adjusting the mask, they do have the potential to contaminate their eyes, nose, and mouth. So for very young children, and it is. It's not comfortable. It can cause some difficulty breathing. And so very young children have trouble with masks, and they are not recommended for very young children.
Okay. Since masks are pretty much recommended for closed spaces and children under a certain age are not able to wear the mask, would you recommend children in a church setting?
Well, that is a difficult question to answer because we know that children, we want them to attend Sunday school, that churches hold child care centers for very young children. And so in those settings, it's important to help the children maintain good hygiene, frequently washing their hands, helping the children space themselves out, good environmental cleaning where children are going to be in a confined setting for a prolonged period of time, making sure that there is good disinfection of high-touch surfaces, doorknobs, tables, things like that are handled, and to minimize the things that can't be disinfected that children hold. So there are ways to do risk reduction and harm reduction for young children and also provide those critical services to take care of children and to provide ongoing learning for them.
Thank you, Dr. Bell. Pastor Jackson, what measures is Bible Way taking to enforce social distancing and mask and sanitation?
Thank you, Sierra. First of all, let me thank Dr. Bell because she and DEHEC, they have been great resources, not just to Bible Way, but to other pastors also. I've been on several calls with pastors all over the state that was sponsored by DEHEC. Some of the measures that we are taking are measures that Dr. Bell and others suggest that we do. One is that we understand that the maximum is 25% capacity, but that is if you can get to that maximum and have safe social distancing. That's what Dr. Bell recommended. For instance, Bible Way is looking at, can we get to 25%? If not, what number is comfortable with proper social distancing? And one of the questions that we had, and I think Dr. Bell answered it, and she may respond again, is that when you talk in a setting like this, in which we can seat 2,500 people, but we have pews, and the pews cannot be removed. And so I think one of the questions we asked was, would you recommend that we seat people in every other pew? And Dr. Bell, and I think you said that that is perhaps a good recommendation for proper 6 feet social distancing, right?
That's right. That's acceptable in staggering people in every other pew so that as much as possible, you're maintaining that 6 feet as best you can.
So one of the things that we're looking at when we return is that how can we safely achieve that? And we will pay close attention to the guidelines that will say there may be a time later in the year that we can relax that we can add more people. We will certainly listen to the experts with that. With that in mind, we're in the process now of determining what would be the maximum capacity when we return at Bible Way. We will still have our 2 services, which will be 8 and 11. We have an overflow room that is next door. Fortunately, it is a great sanctuary that normally seats 1,000 people. So we may be able to add some additional people there at that same distance that we will have here in the worship center. So Sierra, we are looking at that, have not come up with a concrete number yet that we are prepared to announce tonight, but we will soon as we announce the date that we are coming back.
Thank you, Pastor. Dr. McFadden, will the viruses see a decrease in the spread during the summer months?
So that's the question that a lot of folks have, especially as we approach these summer months and see the temperatures warming up. There's been a lot of interest in what's happened in other areas that experience warm climate, whether it's been, those in South America. We've also seen people pay attention to what's happened in Australia, Iran, and what we've noticed is that we've still seen transmission of the virus even in those climates. Many other viruses in the past, whether that be in SARS, whether it be in the influenza, other viruses have responded for when the temperature gets warmer, we see less transmission of those infections. I think this virus is still really new for us, and we are learning this, as I've said often, in real time. And some of that will be determined as we proceed, but we are hopeful that that's the pattern that we will see. However, we cannot be confident and we cannot rely on that as being our sole answer of a solution for this particular virus. So we still have to maintain that social distancing. We still have to wear the mask. We still have to do all those protective things despite the weather warming in the upcoming days or weeks ahead.
Awesome. A follow-up question. We hear how often the virus is spread by coughing and sneezing. Can you discuss how easily the virus is spread by singing, yelling, or loud talking? That was a question sent in from a member.
Sure. I think Dr. Bell just mentioned just breathing can still transmit these respiratory droplets into the air. But talking can as well. It can release hundreds, if not thousands, of these respiratory particles into the air from just a conversation. And that's why it's important to maintain that distance, to wear the mask, but even more so to refrain from having prolonged contact with someone when you are in that close distance. So even just having a conversation, yes, you can still expel that. And even thinking about what happens when you sing, often we sing with force and we sing with a lot of energy, and that when added to those droplets, can expel it in perhaps a greater area around you. So we have to be very careful in how we proceed with those things as well.
All right, thank you. We have a couple of questions that are pretty generic, so if any of you feel that, as if you were able to answer the question, feel free to answer it. The question was asked, how can we get more testing sites? And I guess to follow up, what is DEHEC doing to ensure testing sites are accessible to those wanting to be tested? I guess you could probably.
So I'm happy to address that. We, DEHEC, have worked in collaboration with healthcare systems and primary care providers, community health centers, and rural health centers statewide to markedly expand the availability of testing. One of our primary goals has actually been to expand testing in rural areas, in areas that are predominantly African American, or in urban areas where there is higher density population, but in particularly to serve African Americans who have been underserved. And we did set a goal for the state to test 2% of our population, or 110,000 people, by the end of May, and we actually did achieve that goal. So we have tested over 110,000 people, and we are aware that testing sites are more widely available statewide. There are mobile and pop-up clinics that are being scheduled, and actually are being scheduled in response to a gap analysis that we conducted. So we wanted to learn where testing was not being offered and was not readily available, and those are precisely the locations that we've been working with healthcare systems and healthcare providers to provide testing in those locations. So we do encourage people to take advantage of that. There are no longer restrictions for only those who have specific signs and symptoms of illness. So anyone who wants to be tested can pursue testing. We encourage testing in the medical home if an individual has a provider who's offering testing. But if you visit the DEHEC website, we are making an attempt to post all the testing sites that are available statewide so that people can take advantage of those.
Thank you.
Can I ask Dr. Bell a question?
Yeah.
How is the test actually given? Through the nose, or is it through your hand? How is it actually given to the person that's taking the test?
Thank you for that. The test that's most widely available is actually done with a nasal swab. So it looks like a little Q-tip. And the original test that was being offered was with a nasal swab that you had to go pretty far back in the nasal cavity. But the CDC has established that a nasal swab that just swipes the opening of the nose, that if a good collection is made, that gives a very accurate result. So it's not done with the most widely available test is not done with a needle or drawing blood or anything like that. There's also a test that can be a sample that can be collected from the mouth by just swabbing the cheeks. So it's a simple, quick test. It's not particularly painful, and the people who collect the test have to wear personal protective equipment because it can cause someone to cough, and so they have to be protected and have to wear masks and gloves, but that shouldn't alarm anyone, and that's how the test is performed. It's put in a little test tube, sent off to a lab, and the results come back within about 24 to 48 hours in most instances.
I'm glad to hear that because there's a lot of myths out there about the testing. Thank you.
Yeah, let me also say that we will be announcing a test site here on the Bible Way campus sometimes in June. We've already been in communications with them. So to all of you that are in this community, all of you that are concerned, and you don't have to be a member of the Bible Way Church of Atlas Road, you can come and you can be. So a very special thank you to DEHEC, to MUSC, to Prisma Health, and others who are doing tests all over the state.
We have a couple more questions coming in live. This one's for Dr. Bell. Do you think that schools should reopen in the fall, especially with a lack of understanding of the virus and how it functions?
Well, we recognize the importance of trying to return to normal activities and normal lifestyle as much as possible. So there are ways that we can do this safely if people follow the recommendations. The return to school is important. I know that many families have experienced hardships from everything from childcare to feeding to education has been a struggle managing that at home because that's what schools are for. We are working very closely with the Department of Education to provide guidance, just as we're doing for the faith community, about everything from riding the bus to social distancing in the school setting, how cafeterias can be set up, staggering classes, consideration for the use of masks in the school setting, making sure that parents are aware not to send their children to school if they're sick. So this will be a new normal, and many schools are making decisions that may vary from one school to the next about, depending on what the school looks like, the age group, how they can safely do that. But I do know that the Department of Education is working statewide with schools at every level to help return safely to school. We'll have to continue to monitor disease activity in our community to make sure that we are doing the best job of keeping people safe.
Thank you. Here's another question. Is the test covered through health insurance?
I guess it's the CMS, the Centers for, sorry, I don't remember what that stands for.
Okay.
Center for maybe Medicaid Services, something like that. But has provided guidance that testing for COVID-19 is free of charge. Now, some providers may charge a healthcare visit or an administration fee, but the test itself, particularly on our community sites, there is no charge for that testing.
Plus, Sierra, the state of South Carolina, the General Assembly this year passed a law that all testing will be free of charge. So there will be no charge for the testing.
Thank you. And this question is for Dr. McFadden. Is there a test for COVID-19, or are they testing for antibodies?
So there are two different types of tests that get mentioned in the conversation. The serologic test is the test that relies on getting a blood sample that will check for antibodies. And so the body's response to being exposed to any infection is to create antibodies. And these are a part of your immune system that are important to help you fight infection. It's thought to be found after you've been exposed to. Up to 2 weeks later, you can have these antibodies been formed in the blood. So if they're present, the thought has been at some point you've been exposed to the virus or to the coronavirus itself. The serologic testing does not dictate then what you do. It primarily tells you if you've been infected with it. So you have to really distinguish the purpose of that test. I know that DEHEC and some of the other folks are going to be using data from this, especially as we move forward to determine, where care needs to be given and kind of where those hardest hit areas have been. But it may not have a lot to do with what's happening with you today. So if you're having symptoms or you're having problems, that's not the test you need to be checking for. You need to be having the test that she mentioned earlier, not so much the serologic test at that time.
Thank you. This question is for Pastor Jackson. How will we be handling the serving of communion and collection of offerings here at the church?
Okay, thank you for that. We are in the process of having all of those protocols defined, and we would have them written out, share them with you virtually before we come back. I will tell you that there are those who are working as a committee for this ministry that's putting together all of that. But we have listened to what Dr. Bell and other experts have said. And one of the things that she's recommended on our call with the ministers is that we allow our congregants to touch the communion themselves and no longer have them served by individuals. As it relates to offerings, I think one of the conversations that we had was that allow people, if they can, to drop the envelope into a basket or into a box again without touching as much as possible to minimize the use of touching. So all of those things will be a part of the protocol that we will share with the congregation and with others as we prepare to come back. We are also in communications with other churches, other houses of worship to see if there are some ideas that perhaps they're implementing that we could implement here also.
Thank you, Pastor. A couple more questions. If we were to see an increase of the virus or the number of deaths since everything's been starting to open back up, is there a possibility or a prediction that things may shut back down?
That for me or Dr.
That's
Bell?
for anyone that can answer it, Dr. Bell or Dr. McFadden.
Well, we serve in sort of an advisory capacity. We are responsible for collecting the data, for monitoring for illness and reporting out that information and making that information available to decision makers. So, we expect that as we monitor disease trends, that the decision makers will follow the best advice possible in the best interest of the communities, from a return to life as we're previously used to, the reopening of businesses, reestablishing economic stability, but also maintaining the public health. So it's very difficult to make predictions of that kind, but we will continue to make the information available so that, in addition to decision makers, that individuals in the community can make the best decisions. That even currently, as we are reopening, it's important to pay attention to the fact that we still do have relatively high levels of disease activity in the communities. And that's why it's important to continue to take all the measures that are recommended, even though we are working towards safely reopening. It's important that everyone still must take protective measures.
Thank you. Oh,
Sierra,
Pastor.
one of the things as it relates to the shutdown, particularly of places of worship that's important in South Carolina, is that we were never given a mandate by the governor's office or anyone else to do that. What the governor's office did was say, here are the guidelines, here's what you should consider. They listened to DEHEC and others, and they've said to houses and places of worship that you guys would ultimately have to make that decision. And I am very proud that many places of worship decided to put the health of the congregants above anything else. And so those decisions were made with guidance, but never with a mandate that we had to. And so the reopening has been the same. The governor did not say that you cannot open to a certain day. We are looking at how the trend is going as it relates to those that have been impacted and making those decisions. And we know, and I would say to anyone that's listening to me, that it is a tough decision. There are pastors that are perhaps listening to this broadcast or to this service. It is a very tough decision because at the end of the day, it is important to do what's right as it relates to the health of those who've put their trust in us.
Thank you, Pastor. We have one more question from our live. Pastor Jackson, once a safe percentage of the amount of people are in the church is determined, how will the church implement or control who comes?
Well, that is the question. And I will tell you that I was on the phone 10 minutes prior to this service with my good friend, the pastor of the Brookline Baptist Church, Pastor Charles Jackson. And I wanted him to tell me the answer. And he says, I hope you could tell me the answer. So no one yet has figured out how you're going to determine. For instance, this place seats 2,500, but if we could only accommodate safely 300, how do we determine what 300 come, who comes? We're in the process of doing this. One of the things that I would say to our audience is to please be patient with us and please understand that we don't have all the answers. We want to do what is best. We want to do what is safe. We want to, particularly the most vulnerable population that comes and worship with us. So we are working on that, and we will announce it at a period of time so you will understand. But it may, in all likelihood, in talking to many pastors, boil down to as what is the case now: first come, first serve. But we may reserve seating for some of the elderly and have them sit in an area where we're sure that they're safe, Dr. Bell, as what you and others have recommended to us. So we are working on it. If anyone has any great ideas out there in virtual land, please send it to us. We are not wedded to think that our opinions are always the right and the best. If there are some ideas that other churches are using, we are certainly open to that as well.
Would you, just adding on, piggybacking off that question, would you be open to opening the overflow and the memorial chapel, or maybe like a speaker out in the parking lot?
Yeah, I think the answer is that we will do whatever we could do safely, whatever we could do that we think those who are coming will feel comfortable doing. There have been churches with great parking lot services. We have not had that because of the size of the congregation and what we think is the limited size of a parking lot. We have here at Bible Way about 5 different parking lots. And so in order to have a parking lot service, it would be impossible to get a screen and speakers to each one of the parking lots. So we decided that we would continue doing the virtual services. The overflow sanctuary is available, and that is something that we may use. But the other thing that's going on, and I'll let our Associate Pastor First Lady talk about some of the things that we're doing virtually now that is not happening in the building, like the prayer services and the early morning prayer and the Bible teachers. Maybe she'll share with some of the things that we're doing. Yeah.
Yes, Pastor Jackson. Even before that, I have a question for you.
Yeah.
On social media,
Right.
we do see other churches, especially large churches,
Right.
they're actually doing a survey with their
Right.
membership. Have you considered
Yeah.
about just putting out a survey to our membership just to get some of their feedback on some of the various questions or ideas or that they may have for us?
Well, that is a great question, and I intended to say that as I open. Not only are we going to do a survey, because see, what some of the churches have been doing is an anecdotal survey. It is not scientific. It is just give you your opinion. What we've decided to do here at Bible Way is that we are engaging in a professional company to actually do a scientific survey. So we would take the data of those that view, the data of those that are members, and we will come up with a survey that you see with Gallup or others with a minimum margin of error. We have done that before in making plans on how we should go forward with some of the big decisions that we decided at the church. So yes, we are doing a survey, and many of you will get that call. So when you get the call, please be patient and do your best to answer the questions, and then we will gather the information. Again, the survey will not dictate to us what to do, because at the end of the day, leadership is making the tough decisions, but the survey will help us as we are guided in how we should do different things. So that is a great question.
Yes, Pastor Jackson was just expressing that the building may be closed, but the church is still open because we are still ministering. As you see in our announcements, we are still having men's prayer, women's prayer. Men's prayer is each Saturday morning, and they are on their telephones, their conferences. Women's prayer is every Tuesday at 5 a.m. And my understanding, they have about 60 to 65 people on that prayer line praying. We also continue virtually that our youth pastor has a pre-recorded service, that they pre-record their services for the second and the third Sunday, and it airs at 6 p.m. Also, we are virtually sitting out for our children their Sunday school lesson. So we are really still having church. We're still ministering. Every week we get an email from one of our staffs to all of our clergies, for those that are shut in, for those that are sick and those that are in hospital, those that have experienced bereavement, and we are able to telephone, text, send emails out, and we are still ministering to our congregation and also to the community. We've been having a lot of Zoom virtual meetings with our board of trustees and with our staff here at church. So we are still ministering. We are still about kingdom work here at the Bible Way Church of Atlas Road. And so we ask you to please go on our website page, go to BWCAR.org, and you can, for that further information and direction, and visit all of our services. And please stay connected to your family, stay connected to your friends. We miss you so very much, but we are still having church.
Yeah, let me also add that every Thursday, a very special thanks to our men's ministry. Every Thursday at 7 o'clock, there's an international line open, and they are engaging men all over the country, in fact, all over the world. Our deacons meet every Sunday morning by Zoom conferences, and so we have Sunday school classes that are meeting by Zoom and by teleconferences. So we are doing a lot. Our seniors had a wonderful time last week, where we know that there are a lot of seniors that are not on Zoom. They did call in, and they had a conference call, and I understand that our worship leader was singing old-time songs, and they did not want to leave, and they had church right there. So we're doing all of these things. The other thing that I want to say, a very special thank you, because we have been able to minister to the community. Every day of the week, we are providing for senior citizens and those that are in need. We've partnered with District 1 to provide food and lunch to people that are in need. So we have been really, because our goal is to minister. The church building does not minister, the people minister. So we have done that, and we have done it in an excellent way, because those of you that are out there, you have done it. You've done it in a great way. One of the things that I am perhaps most proud of is that we decided also as a church to reach out to congregations that were impacted by COVID-19. And we knew of 2 pastors that died, one in Saluda and one here in Richland County. 2 congregations that lost their pastors. One lost their pastor and first lady. in a matter of weeks. And what the Lord laid it on our hearts to do was to minister to them. And so we sent them a financial blessing from the Bible Way Church of Atlas Road, just to say we're thinking about you. They weren't expecting that, but we did it because God says in the midst of all of this, we have to be reminded that we are in this together. So thanks to you and thanks to your continued contributions, we have been able to do all of these wonderful things that we've done. And so God gets the glory out of all of that. Thank you so much.
Pastor Jackson, since we're talking about virtual church, I have a question, because a lot of people are saying now with the virtual church and everybody's on social media with their services, they're in their living rooms, they're in their backyards, they're just everywhere. Do you think the church is going back to the old way, or this is just a new way, having virtual church?
Well, the good answer to this, well, the good news, I should say, is that we're not going to ever go back to where things once were. And that is perhaps, Dr. Bell and Dr. McFadden, a good thing, because what I think will come out of all of this is that we'll realize that we are our neighbor's keeper. We are to look out for each other. And it really doesn't matter the size of your congregation. I was on the phone today with a pastor who pastors a small congregation, small in the sense of compared to the size of the Bible Way Church of Atlas Road. And we have so much in common, because he says, on Sunday morning, I'm now broadcasting to the whole world. And we jokingly said, every church is a mega church now. And that's important, because perhaps in the past we've been too obsessed with certain sizes of congregation and the certain size of a church and all that they do. And I think what has happened is that we all realize now that we can look in a camera and we can say an encouraging word, and someone who's just buried a father in New York City could be encouraged by that word. And it really doesn't matter the size of your congregation. It just determines if you have the will to put that message out, and that is a good thing. So thank you.
Thank you, Pastor. Here's one of our final questions. When church does plan to open its door to the congregation, do you think that everything will happen in steps, or as we see fit to make changes as we go?
Again, we're in the process of putting that together. I would tell you the simple answer is yes, it will be in steps. It will be in phases. For instance, if we come back and social distance dictates that we have 6 feet separation on every pew, every other pew, that is the initial step. That is listening to the Dr. Bells. That is listening to the Dr. McFaddens and others, and say, let's do what is safe to do. That's the beginning. Listen, I have a mother who will be 86 years old this year. She, prior to this, would hardly ever miss church, Dr. Bell. I have seen her come to church in excruciating pain just to say that I am worshiping God. And I know when the doors are open, I've already asked her, I says, Mom, when church is open, are you going to wait a little while to see if the virus can calm down? She says, I'll be right there. First Sunday it opens. So we want to make sure that at 86 years old, she will be safe. At the same time, we have a lot of young adults and young people who are 17 and 15 and 25 and 30 and 40, and they may feel somewhat invincible. They may feel like, I don't really have to do this. And so what Dr. Bell said and Cedrek said is so important. We will require a mask, not just to protect the young people who we're asking to wear the mask, but to protect the elderly person that they may be in contact with. And so, yes, we will be in stages, we will be in steps, and we will be listening a lot to what DEHEC and what the experts are saying.
Thank you, Pastor. I'd like to open the floor to the panelists. If any of you have any closing remarks, anything you'd like to add?
So I'd just like to say that what we hear about the advice is certainly important to hear, but it's also important that we recognize our own medical histories and stories. There may be certain things in your medical history that may dictate that you behave differently from your neighbor. And so we have to remember our own medications, our own health struggles that we may or may not have, and help that form the framework at which we return to whatever our life may be. And so use that as a part of the decision that you make.
I think I would just add that we have actually a lot to be optimistic about, and we have to weigh that against our concerns. The optimism comes from the more wide availability of testing so that people can know and that can take measures. And the other thing to be optimistic about is that there are things that we can do to take control of those things that we can control to return to normalcy. And, I agree with going in steps. We hope that all of these steps will be steps forward. And as we move towards normalcy, that we won't see any setbacks in terms of disease transmission. But we weigh that optimism against the concerns that there is still a relatively high level of disease activity. We are hoping to see some leveling off. But as we reopen, that I think can go in either direction. If we reopen and we do it safely and the disease levels stay at the same plateau for a while and then decline, then that will tell us that we can continue to move forward with normalcy. But there is the potential that we can reopen, and if people don't take those measures for which they do have control, we can see that go in the opposite direction. And whether or not this will be the new normal for us, some other things to be optimistic about is that at some time in the future there will be a vaccine. And the question is, will we be looking at COVID-19 like we look at the flu now, or it will be a disease that circulates in the community at some level, but that we will have more control of it and that we can return to what we previously considered to be normal. But there will still be individuals, and we recognize that as African Americans, that we have underlying conditions that do put us at increased risk if we have some of those underlying conditions. So we have to pay attention to taking special measures to protect our populations and our communities.
Thank you, Dr. Did you have any other
I just wanted to say as a closing remarks, I want to particularly thank Dr. Bell for being here at Bible Way, because she certainly has answered a lot of my questions and really extracted some of the myths about COVID-19. And I wanted to just to say, we pray that the listening audience and the participants of this town hall meeting really take this serious, because it is a serious disease. It is a serious virus. And we need to know that we need to take all precaution and comply as much as possible, just not to protect our lives, but the lives of other people also.
Let me say also, as we prepare to close, a very special thank you to our panelists. Thank you, Dr. Bell. Thank you to our very own Dr. Cedrek McFadden, to our First Lady, Associate Pastor Jackson. And I want to take this opportunity to say to all of the members and friends and all of those that have viewed and supported the Bible Way Church of Atlas Road for these past 10 weeks, thank you very, very much. Not just for your participation, thank you for your giving. Thank you for allowing the ministry to continue to do what God has called us to do. And I know we all want to get back, but more importantly, we want to get back safely. And I will close by something I think I'll open by saying, remember that the building is not essential. We've heard in the last couple of weeks how essential the church is. But I think what was missed out of all of that is that when they talked about it, they were referring perhaps to the building. The building has never been essential. What Jesus said to Peter was, upon this rock I'll build my church. He did not say that I'll build a particular denomination, a particular church in a geographical area. And then it is so important to what he says to Peter. He says, and the gates of hell will never prevail against his church. So we are the church. We are people of worship. And when you worship in your home, you're still worshiping God. When you give your tithe and offerings to your local ministry, to Red Cross, to Bible Way, to others, you are still doing God's work. And we say to you a very special thank you. And as Dr. Bell says, one day this will subside. We will get a vaccine. But I hope that we'll never forget this moment. And I hope that what comes out of this is this unity, this sense of we're all in this together will always be the case. And we will never get back to who's the largest, who's the biggest, who has the greatest congregation, who has the best choir, who takes up the most money. I pray to God that those questions are never asked again. And what is asked is that how many people are we reaching? Whose life have we saved today? And if that is the question, then God gets the glory. So thank you, Dr. Bell. Thank you, Dr. McFadden. Thank you to Pastor Jackson and to all of you for joining us. Sierra.
Thank you, Pastor Jackson. Before we hear the benediction from Pastor Willie Mae Jackson, we do want to let you guys know if you have any further questions, you can send them in to info@bwcar.org. And here's the benediction from Pastor Willie Mae Jackson. Thank you.
Let us pray. Oh God, we thank you, first of all, for your presence, Lord. We thank you, God, because we have a pastor that has a vision, and we thank you for our senior pastor, Darrell Jackson. We thank you for our guest panelists, Dr. Bell, Dr. McFadden, and also for our wonderful host, Sierra. She did such an excellent job. So we thank you for every ear, every eye that participated on tonight. God, you said in your word in Hosea 4:6, people are destroyed for a lack of knowledge. God, we thank you for the information that we have obtained on tonight. So with this information, we have responsibility. So God, we ask of wisdom, how to use it, where to use it, and who to use it with. So God, we give you glory, we give you honor, and we give you praise, because with this responsibility of knowledge, we will do what we need to do and apply it to our daily lives. We thank you. In Jesus' name we pray. Amen.
We'd like to thank our internet audience, especially our first-time viewers, for tuning in. There are many safe, secure, and easy ways to give to Bible Way Church of Atlas Road. Online giving is available to members and guests through My Connections at BWCAR.org. You can choose to give through your bank, checking, debit, or savings account. You can give via our mobile giving app by texting BWCAR along with your giving amount to 73256. Or you can mail a check to P.O. Box 90309, Columbia, South Carolina 29290. Please do not mail cash. Financial donations will also be accepted at the church on Tuesdays from 12 p.m. to 6 p.m. If you desire prayer, please call 1-888-776-1238. If you feel as if this service was a blessing to you, please be sure to share it to your page. For additional announcements and for more information, please be sure to visit our website at bwcar.org.
Thank you for joining us today. We miss your beautiful faces and the fellowship. Please stay encouraged, stay connected, and stay with God.
Again, we say thank you so much for being a part of this service. We ask that you share with your family, friends, neighbors, co-workers. Let them know that although they may be shut in, that they're never shut out. God's word can get to them. Thank you for being a part of what we're doing here at Bible Way. We continue to pray for you and for all the ministries all over this world. We want to also remind you that if you need prayer, You can call us anytime here at the church. Someone is always available to pray with you and for you. Again, thank you for being a part of this service. Look forward to seeing you the next time.